गुड मॉर्निंग एवरीवन। तो आज हम नीट पीजी का प्रीवियस ईयर क्वेश्चन सॉल्व करते हैं। द क्वेश्चन इज अ 10-year old child presented with complaint of diarrhea and weight loss. On examination, his height and weight are lesser than expected. And on lab investigation, class 2 HLA DQ2 is positive. So, what are the key points in this question? The key points in this question is to reach the diagnosis are that the child is having or the patient is having diarrhea and weight loss along with class 2 HLA DQ2 positive status. Okay, so these things point towards celiac disease. What is celiac disease? Celiac disease, also known as celiac sprue or gluten sensitive enteropathy. So the name represents the gluten sensitive enteropathy. That means in this the patient will be sensitive to the gluten, and in result of which there will be enteropathy in that patient. So, to avoid this, what we will do, we will advise the child to have gluten free diet. Now, what are the diets that are avoided in celiac disease are the diets that contain gluten. So, the mnemonic for this is brow or bro, B for barley, R for rye, O for oats, and W for wheat. Okay, so these things or these diets should be avoided in a celiac disease patient. Next is what are the diets that are allowed in a celiac disease patient? So the mnemonic is SOMRP, that is soya bean, maize, rice, and potato. Okay. Next thing is what we do to screen celiac disease. For screening, we will test serum antibodies. Okay. So to test serum antibodies, what are the serum antibodies to be tested? One is anti-TTG. This is an IgA antibody. Next is anti-endomysial antibody. Next is deaminated anti-gliadin antibodies. Okay, and for the diagnosis in which the patients are having the positive antibodies, it is confirmed by biopsy. From where we will take the biopsy? From second part of duodenum or from proximal jejunum. The second part of duodenum is preferred site for biopsy. Next is what are the microscopic findings that will be found on biopsy of the second part of duodenum. The microscopic findings are that there will be intraepithelial lymphocytes, intraepithelial CD8 plus lymphocytes. Okay, and the next is there will be villus atrophy, and the next is there will be crypt hyperplasia. So these are the important things that we have to learn about celiac disease. Okay, so this is all about celiac disease. And now we will see what our other diets are given in the respective diseases. The fat-free diet. The fat-free diet is advised in the disorders that cause steatoria. Okay, and the lactose-free diet is advised to the patient who is having lactose intolerance. How we will know that there is lactose intolerance? Lactose intolerance is due to lactase deficiency and due to which the patient will present diarrhea, abdominal pain, and bloating. We do a lactose tolerance test to diagnose lactose intolerance, and that is a breath hydrogen test. Next is a low carbohydrate diet. A low carbohydrate diet is advised to the patient having diabetes mellitus, as the patient is already having increased glucose level in the blood. So we advise the patient to have low carbohydrate diet and instead increase the fibers intake in diet like oats. Okay, thank you so much for watching this video. Hope you enjoyed and hope it was helpful to you. Thank you so much. These are NEET PG previous year questions, so these questions are very important. Go through it. Thank you for watching this video. Thank you so much.